care, basically the medical versus non-medical. And then I'm going to go into a little bit about the company I work for, Home Care Assistance, to give you some specifics on what we do to partner with the Parkinson's community, and how we leverage our amazing resources to help us keep our patients with Parkinson's home, like PD Well and Sherry. So we'll get into it. Let me share my screen. Oh, I thought I could share my screen, but now it's telling me I can't. Did she hop off? Oh, there we go.
I made you the host, so.
Thank you, got it.
Yes.
You should, hopefully.
All right, everybody. Can you guys see this? Okay, great. Go ahead and speak up or put something in the chat box if you guys have questions through this. But these are some funny terms that we use that mean very different things. And so thought I'd start off by saying home care versus home health. What is the difference anyways? Key points today for this part of the presentation, we're going to go through what home health is, what home care is, and then triggers for each so that you know what to watch for when you might be looking at one of these options. So home health is the medical piece, and that is where PD Well and Sherry come into play. So they are the therapy. Let me see, admitting a couple more people. They are the medical side. And so many home health companies have nursing, speech therapy, occupational therapy, physical therapy, and then a lot of them also have a bath aid. So I don't know if you've ever had any of these services before. This is a variety of what most home health care companies offer, but I can't say that every single one offers all of these. So just something to keep in mind. If you do want to have every single service, you need to make sure that that company offers all of those. Okay, so what is it really? It's usually used following a hospitalization or a surgery, and you need a doctor's order to start. So if you are hospitalized and you're getting ready to go home and your discharge planner is working with you, oftentimes they're going to say, do you want to do home health? We can get this in so that you can keep gaining ground at home. And then once you get to maintenance, then you should have been given the tools through home health to be able to stay there. It's medical in nature and requires a nurse or professionally trained therapist. There's a limited time frame on this. And I think that's one of the bigger misconceptions about what home health is. So it's based on visit approval and your ability to improve. So like I said, once they get patients to that maintenance phase, then they look at discharging. It's covered by Medicare due to a medical necessity, and then it includes those nursing checks, all types of therapy, and then it can include a bath aid. The bath aid visits are usually a few times a week, and they'll come out for about an hour at a time. That's the same with all of those visits, and it's going to be specific to you and your situation or your loved one's situation on how that's set up. You might see the nurse once a week, you might see the nurse 3 times, and same goes for therapy. They come out for a shorter amount of time to do their visit and their therapy, and that entire time they are assessing you, setting new goals, and making sure that you know what to do when they're gone, so that you kind of have your own routine to follow through on the days that they don't come out to visit you. Home health can instruct family or professional caregivers on proper care following discharge from home health. This is one of the ways that we partner. So because they come out intermittently throughout the week and for a short duration of time, making sure that there's a family member or professional caregiver involved is really important to patient success and following that plan of care and that therapy program throughout the week, and not just at the days and times that nursing or therapy is out there. So home care is non-medical. What does it provide? So home care, the non-medical type, can be started anytime and is usually triggered by a client or family member. So you don't need a doctor's orders for home care. This is a decision made by the family or the client themselves. It's not medical in nature and has the ability to have a wide range of care. Payer sources, because it is not medical, Medicare is not one of the payer sources. Private pay is a large source that we see, but also commonly accepted is long-term care insurance policies. So if you have one of those, it's important to note in the policy, make sure that you see what's actually covered. The homemaker services or the non-medical caregiving, there's usually definitions listed within those policies. I'm happy to walk through a policy with anybody. If you guys have questions, I actually was just at someone's house last week for a couple hours going through their policy. And in the state of Nebraska, we're not required to have a medically licensed home care provider. So even if your policy says so, still something that you can check into so that it doesn't disqualify maybe the company that you wanted to use or just really lessen that pool that you have to choose from. Medicaid waiver is another option. So that's income-based. You have to qualify for Medicaid first. And then there's a process to get on the waiver program. So the state realized that keeping patients home is one of the most highly desirable situations that patients want to be in, and then also that it's usually more cost effective and outcomes are really good when we can keep people in their own environment. So there is now a centralized line. If you or somebody you know is on Medicaid already and you just want to get onto the waiver program, the one that we are approved for is called the AD or Aged and Disabled waiver. And there's a phone number and an email that we have to send the referral into, and then someone contacts that person and goes through their entire assessment process. What happens after that is they approve you for the amount of hours that they found necessary based on that assessment, and then you get to choose the company that you would like to fulfill those hours. There's a lot of veterans out there. I think we have each quarter, we run those numbers and we see over 100 veterans in the community, probably more than that, but there's over 100 utilizing their benefits. So to open up your veterans benefits, you just have to establish care through a primary physician at the VA hospital. So you can keep your own physicians that you regularly see and work with, but you do need to go see somebody at the VA hospital. They have a social worker that will talk to their internal system that can get your benefits turned on. Non-medical home care, you can get assistance with all activities of daily living and instrumental activities of daily living. So if you have one of those long-term care insurance policies, you might already have seen these terms, ADLs or IADLs. Often to turn one of those policies on, you do need to require assistance with at least a couple of them. Each policy says something different, whether it's 2, 3, or 4. But ADLs include bathing, showering, ambulation or walking and transferring, help with feeding, dressing and grooming, helping to the restroom, and any continence assistance. IADLs include using the telephone, shopping, meal preparation, housekeeping, laundry, transportation, and then handling medications, as well as maybe sending out checks or handling any finances. Triggers for starting home health. So again, that would be if you're discharging from a hospital or a facility. If you were in the hospital and then went to rehab, you still might come home from that rehab facility with home health. If you're on new medications and you need to be monitored for a variety of reasons, that's a trigger. Following any surgical procedures. Frequent falling is a big trigger for this. We want to look at, gross musculature as well as your vestibular system or your internal balance. There's many options out there for help with that. Your change in living environment, decline in weight, or a change in medical condition. So these are some of them are very broad and some of them are very specific, just to give you a better idea of what you would need to pay attention to if home health needed to get into the picture. And then home care, the non-medical side, you would think about bringing in, if you're having difficulty managing your medications, or if a loved one is having difficulty getting them on time, if you come and visit them and you see pills on the floor, or in the sink, they might be trying to take them, but might have gotten away from them. Difficulty with bathing, difficulty with grooming or dressing, if they're no longer able to drive or transport themselves safely. If they could use some help with shopping, groceries they can be very heavy. There can be a lot of trips. Then you have to get them in and put them away. So that's something that you can get help with. Transportation and medical appointments. So this is a big one that when I talk to physicians in the community or other medical professionals, making sure that they can see you and they can evaluate you. Telehealth is a wonderful thing that we're utilizing more and more, but it's so important to be able to get to those appointments and not miss anything. Help with household upkeep, companionship. I think that's something that I know for myself when I come to the time in my life where I'm going to need some home care. That's something that I would probably downplay needing or wouldn't recognize as soon as maybe my loved ones would recognize. Isolation is a big problem now more than ever, and so it's not uncommon for us to get calls just to have somebody come around just for some companionship. And then assist with care post-discharge from home health. So we can be used in congruence, and oftentimes it's really helpful to be used at the same time so that we can learn what exercises to do, how that specific patient does them. We understand where they started from and what maintenance looked like, so we're not coming in after and trying to figure out where they were right when they discharged from home health. That way we can report back to that home health company or maybe their outpatient therapy group like PD Well and say, hey, there's been a big decline. I think that we need to get them back in. Any questions on the differences between home health and home care? Okay. Alrighty, so now I'm going to go into specifically the presentation on home care assistance. So let me get this shared. Okay. All right, everyone can see this? Thank you. I can only see Sherry, so that's helpful. Thanks, Sherry. All right, so quick introduction. I wanted to do this one first, but it didn't make any sense. I'm Whitney McCoy. I have a degree, actually. I have a bachelor's in speech pathology and audiology from University of Nebraska, Lincoln, and started with HCA in 2013. I started as a caregiver. So I had worked in nursing homes and memory care and even for another home care company. And fell in love with the way that we did things. So I actually bypassed my post-graduation plans to attend a graduate school and stayed, opened up our Kansas City office, and then came back to Omaha a year later to be a care manager here. I did end up going back to the Med Center to get my BSN, and I am a registered nurse now. So much of what I did as a care manager really inspired me to go on and become a nurse, to be as the best support I can be to our clients, our partners, and when we're elevating the level of care that's provided at home, I just think the more people from the medical side that can be a part of the non-medical, the better. So enough about me. I think we can all agree, though, there's no place like home. maybe some of us are feeling a little sick of home and want to get out more lately, but overall, I know after even a vacation, I'm ready to get back home. So life after 2020, I pulled up this Harris poll that they did and revealed that 83% of older adults prefer to age at home. That number is not surprising to me. Over 4 in 5 seniors aged 50 plus would prefer to live in their own home over a senior living facility if they required daily care as they aged. 43% would be more open to home care if they needed care as they age, if the care provider was someone they selected and were able to form a relationship with or companionship with. Over half of those with living parents would be interested in hiring in-home care for their parents that offered safety and wellness procedures at home. So definitely the majority of those out there would like to see home care as a viable option. And so we're excited that that is, just strengthening, especially here in our region. So the basics of home care. Knowing when it's the right time to look for home care can be overwhelming and confusing. Making the decision to have someone come into your personal life and begin handling intimate daily activities can cause a lot of anxiety. Starting with the basics can help you feel more educated and empowered on controlling your independence. So what's home care? We already discussed it's a non-medical service provided wherever you consider home. I think some people don't realize that even after many seniors make the move to a facility, whether it's an independent, assisted living, memory care, or even a nursing home, we are still going into those communities and providing additional care. I know when I was a CNA in college that I worked in a memory care unit, and we had outside home care agencies coming in to provide support. So I think learning about what it is still important, even if you do think that a facility setting is something that you would prefer, because it doesn't always fill the entire gap that you might have in your own personal needs. Some may need it temporarily following an illness or surgery, while others may want to hire a live-in caregiver to help them better manage the challenges of illness and aging. So what services do home care providers offer? A variety of services can be offered depending on the provider and the client's needs. They're categorized by those ADLs and the IADLs. ADLs, when you think of them, it's helpful to think of them as the basic self-care tasks we learn very young. And then those IADLs, we learn more into our teen years, but they require more complex thinking and organizational skills. We also, home care companies are also offering household task assistance. So again, another list of a kind of more expanded list of the ADL assistance that you could get at home. So anything that's hands-on, whether it's bathing, grooming, dressing, using the toilet, getting around. With home care assistance, we provide care from where our clients can do it independently. So we're just standing by to ensure that things are being done safely, all the way to total dependence. So we're able to operate mechanical lifts. We're able to help with feeding tubes. We're able to help with wound care and dressing changes, as well as oxygen, catheter, ostomy care, and more. Instrumental activities of daily living, plus the household tasks, include that medication oversight and reminders, meal planning and preparation, grocery shopping, transportation, companion care. There's that range of motion and exercise, telephone and mail assistance, calendar management that really goes with the transportation and making sure that you get to your appointments and that you have regular appointments and we don't miss them. Light housekeeping, laundry and changing bed linens, pet care. We just entered fall, so we've already been helping people with seasonal decorating and organization. I think that's something that is less commonly thought of that we can come in and help with, but whether it's making sure that the environment is safe and getting clutter out of the way, or it's just something that is an activity that they can get done together, and it's nice to have an extra set of hands to help get the place organized. So benefits of an in-home caregiver. For not only the client, but the family and any loved ones, it really provides a peace of mind. With our company, we allow the clients to be the driver. So we do our best to match you with the caregiver that's going to best fit your personality and your physical needs. But you are the ultimate green or red light for us. So we'll do everything we can to set everybody up for success. But you get the peace of mind of knowing that there's somebody it's very thoughtful when you guys are paired together. And at least with our company, that, we never allow a misshift to happen. So even if your personal caregiver that you're used to is out sick or, God forbid, gets into a car accident, we never miss those shifts, and we guarantee coverage. For me specifically, I know this will be another one, control. When you're getting to the point where you need extra help, not feeling in control is something that we hear a lot. You're losing control, you're losing your independence. We want to shift that mindset and really show you that you get to keep as much control as we can possibly give you over your life. So you got to stay in your environment. One of the owners here, she always says it's so funny that we moved this woman out of her assisted living, and she said, I was just so sick of those curtains, just looking at those curtains every day. You get to pick your environment, you get to pick your art, your bedding, all of that. Your schedule and meals. I know in facilities, the days are kind of built around the schedule that they have with activities, as well as the dining room. And not everybody wants to get up and eat between 7 and 9 in the morning and have dinner finished by 6 p.m. So at your own home, you're in charge of that. You're also in charge of what you're eating, which is pretty big. The decor, and then your guests. That was something new after 2020. It was nobody's fault that facilities had to place restrictions on visitors. But we never had to go into that kind of a system at home. And so allowing, whoever they wanted at home was a nice freedom to be able to have, and some more control of that environment. Your independence, getting home care in at the right time will help you maintain that independence, so that you don't have a fall or medication error, or experience malnutrition or dehydration that gets you hospitalized, and then kind of through the whole system of going to rehab and then hopefully coming home eventually with home health or something. Reduction in falls and hospital admissions, and then prevention of caregiver burnout. So, there's a lot of people out there that thankfully have family support or friends support, but we have to take care of them too. Caregiver burnout is a real big thing. And then this illustration, seeing this firsthand, when you walk into a home and just the client or the potential client might look, pretty good, but the caregiver, you can see they are burning the candle from both ends. So caregiver burnout, more than 40 million adults in North America taking care of are taking care of an elderly, chronically ill, or disabled loved one. That's a huge number. 70% of family caretakers take care of one person over 65, while 22% help 2 people, and 7% care for 3 or more. I think people find themselves in those positions when they, as an adult daughter, you're taking care of your own parents plus your husband's mom. You're kind of trying to do it all. Psychologists define caregiver burnout as a debilitating psychological condition brought about by unrelieved stress. In addition to coping with a loved one's illness, they might also deal with financial pressures, changes in family dynamics, and a general disruption in family life. Signs of caregiver burnout. Some of these are hard to recognize, and so you have to be a little bit more in tune with how did I feel before I was putting this much work into caregiving? The lack of energy, I think a lot of us feel that naturally. So it takes a little bit of self-awareness to see these things, but overwhelming fatigue is hard to deny. Sleeping problems, that's too much or too little. So even if you can't get out of bed, or if you can't stay asleep and 3 a.m. you're up scrolling on your iPad, that's a problem. Changes in eating habits, weight loss or weight gain, a feeling of hopelessness, withdrawing from or losing interest in activities you once enjoyed, neglecting your own physical and emotional needs, feeling like it's controlling your life, which can then make you become unusually impatient, irritable, or argumentative, especially with the person you're caring for, and anyone else that you come in contact with. Anxiety about the future, depression or mood swings, difficulty coping with everyday things. And then a lot of this mental strife can manifest physically. So if you're having headaches, stomach aches, back pain, vision disturbances, hearing disturbances, pay attention to that. And then lowered resistance to illness. If you're getting sick all the time, if you feel like you have a constant congestion or a cough, that, if that lasts a long time, that might not just be something that you have, this could be a long-term problem. So preventing the burnout. We've all, many of us have been on a plane, and we can picture the stewardess standing there with the mask and telling us, put it on your own face before you take care of anyone else. We have to keep that visualization at the forefront of our minds. So ask for help anytime you can. Don't be afraid to ask for help. Delegate as well. If there are other family members or other people that can be part of the solution, try to delegate some of those tasks out. Take care of yourself. Sometimes some of us have to start small with that and just choose one thing, whether it's going on a walk every day, or listening to a free guided meditation online, or making sure that you see one friend once a week. You hold those coffee dates. Check into family leave benefits at work. For those of us who are still working and do have family at home to take care of, check into your benefits and see if there's anything there that can help you. Respite services, another great thing to check into. Planning ahead. Again, when we're talking about control and independence, this is what really helps you maintain that. So making a plan allows you to have control over your decisions for senior care. Everyone's priorities are going to be different there. Ask the right questions. Always pick an agency that shares your values. These are a couple questions that I listed that I always recommend anybody I talk to. I think it's smart to interview a couple agencies. There's a lot of commonalities, but there's a lot of differences too. And so I think it's just good to find your best fit. And these are some questions that can help guide you on that. So, do you provide replacements when my caregiver is sick? What's your minimum hours that I would have to sign up for? Who oversees and manages all of the care at my house? What are my payment options? How do you select the caregiver that will work with me? What's your retention rate with caregivers and clients? This one, I can always tell when someone's in the industry, or if they've got a family member that might be a nurse or somebody that has kind of been here and done that. There's a staffing shortage across every single industry right now. And so that retention and stability rate is so important to get a clear idea on with the company that you're going to be bringing in. Safety is our top priority at Home Care Assistance, and we know that you cannot attain the highest level of safety if you have a revolving door of new people in and out of your home. So specifically, we have a 95 and 96% stability rating, which means that once a team is set at our homes, you just see about a 4 or 5% instability or new people coming in that you would have to ever meet. Ask about their retention with clients too. That shows, not only are they successful in having people pick them, but do they stay? And what is their average length of stay? Do you provide training for the staff that comes out? Is it disease specific? Everybody in this room is probably here because they've been touched by Parkinson's, and it's a very unique condition with a lot that needs to be focused on, with exercise, with medication, with diet and rest. So important to ask, do you guys know about Parkinson's? Do you have partners? Do you have a disease specific training that you're gonna take my caregivers through to make sure that they can best take care of me and my needs, as well as report to any partners that I have on my team? So for instance, if I go see Sherry's team at PD Well every week, are you guys going to be able to talk to them and kind of talk the talk so that you guys are all on the same page with my care? Would a manager come out for regular visits? So, I always hear from people that aren't happy with who they're with. I liked who I saw at first, and then I never saw her again. We want to make sure that you guys know who we all are, and if we're going to be coming and providing such an intimate service, you need to feel comfortable with us. So how often is the person managing all this coming out to see you in person and visit with you? Who do you partner with for medical support at home? That home health, hospice, outpatient therapy, any medical providers or physicians? Good to know if there is already a relationship established with the people that you like to use, just like I explained above. And then do you offer a free consultation or a free home safety evaluation? Consults are typically, I have not heard anybody charge for them, which is really great for you guys. And a free home safety evaluation is included in what we do. So, the care manager walks around the house afterwards, does a little tour, and make sure that we can make any recommendations to modify the house if we need to, or just do something as simple as picking up some rugs, which I know can be very upsetting if you don't want to pick up that one rug. Okay, let's move on. In addition to those questions that I just put up, I have a sheet that I can send out to you guys if you're interested. It's a generic sheet that we put together at Home Care Assistance that you can use to guide as you're comparing companies. So you can walk through this, see, do they have people on call? Do they guarantee a caregiver match? Who's the backup in case of emergency? Are they caregivers screened, bonded, and insured? What's my liability in this? Do you guys take care of taxes, withholding, and workers' comp? What are the benefits to the caregivers? Do they have a 401k? Do they get PTO? What's the value that we're creating for these people that are going to be in my home as well? And then it's just a nice little checklist for you to go through and kind of fill in the answers for everybody else. I have a chat here. Oh, yes, Dorothy, I can send this form out. I'll probably get it to Jessica, and or you guys can direct message me and I can send it directly to you. I'll try to write all these down before I get out of here. Okay. Okay, so I think I know someone who could utilize professional care in the home. Do your research early before you are in crisis mode. I try to educate people. That's really my primary job now, is just education, since I'm no longer a care manager. As soon as you have a diagnosis or your loved one has a diagnosis, start looking at what might be coming down the road. And maybe it never will, but at least you've got your research there and you have it in hand, so that if that late night hospitalization does occur, you know who you're calling in the morning and they already know you. I am going to answer a question that came through in the chat from Gerald Hopp. What success have you had with finding men to be a part of the ADL and IADL tasks? That's a great question, Gerald. We actually have a pretty high percentage of male caregivers. And obviously we are non-discriminatory, so we hire and match based on personality and skill set. So we love it when people are open to having males come out. They are, I've had a client, I started her care in 2007. Cares, and if it's the opposite sex, I think we can find that to be a little bit off-putting maybe at first, but they are still a pair today. And he's her favorite caregiver, or yes, he's her favorite caregiver. And so I think being open to just the personality and skill set matching really allows you to get the best fit, regardless of if it's a male or female. That's a good question, though. It is, healthcare, nursing and caregiving, it is a female-dominated industry. Naturally, a lot of women are caregivers. And so, yes, there are many males, though, too. So when you're planning ahead, identify what's important to the individual receiving care. So cost usually is one of the first questions that people ask, because it's a very real thing that we've got to focus on and make sure it's doable. Also, if you're planning for a spouse or your children, that's something to keep in mind. Caregiver continuity is usually the next one. We want to make sure that stability is there, who's going to be coming out, and then who's supervising them. And how involved are they with everything? Are you really going to be the supervisor of this team, or is there somebody else that's going to be doing that for you? Kind of asking the cost question, and then all of the other things that follow to say, where's the value in this cost? Know the right questions to ask. We went over some of those, and I can get that sheet out to you guys, the comparison sheet. And then if ever in doubt, I'm happy to talk to anyone regarding home care options, even if we're not the right fit for you. I'm from Norfolk, Nebraska, and so I get calls from people that know my family there. We don't have an office there, but I will talk them through what questions to ask, what to look for, when the right time to maybe pull the trigger is. Or, if you have a contact, or you really get a good feeling from this other company, then that's definitely what you should do. But I'm all, been doing this for a long time. So if you guys want to talk to me about anything, I'm happy to do that. So why is HCA so special? Our mission is to change the way the world ages. And that's why we opened up in 2011. We really wanted to remove that glass ceiling that so many people would hit, where they would be home and they would have a changing condition, and then they were told it's time to move. This can no longer be done safely at home. So being able to allow people to age in place and change the way that aging looks for our seniors has just been the greatest mission, and something that I get excited to live out every day. It's not so much about what is done, it's how it's done and by whom. There's a lot of people out there that can help you with a shower, or help you complete maybe your exercise regimen, but it's how they do it, and it's who's doing it with you. There's some personalities that fit better, and there's some that just don't. And having that option to have control over who you're going to allow into your home is so powerful, rather than maybe being in a facility and pressing a call light, and whoever comes down the hall is who's there to help you. So there's that caregiver matching that we do, the personality, skill set, expertise. So we've partnered with experts in this region on Parkinson's disease, Sherry Prince being one of them, helping us to really fine tune our Parkinson's specific training. So there's that disease specific training. There are a couple checks below. We look at, in the first half of the training, what is Parkinson's disease? How does it affect somebody physically, cognitively, socially, spiritually? And then the second part of that is, Jim. Where is Jim in his Parkinson's? What does that look like for him? Does he have a deep brain stimulator that we need to focus on, or how often is he taking his meds a day, and what time are those, and what's the diet associated with that. Client specific training, that's that second half of care, or of that training that we do. So we want to make sure that the care team has a good understanding of what Parkinson's is, and then also that they are going to be there to meet that specific client where they're at in their condition. That goes down to how I like my dishwasher loaded, how I like my towels folded, and how much coffee I want in my, or how much cream I want in my coffee. Care management is the key to what we do. We've got 5 care managers here in Omaha and 4 in Lincoln. Their backgrounds range from nursing to social work. We've got one here in Omaha who's actually an occupational therapist. And so they really have tremendous background and training to be able to help develop a care team, do the introductions and the training, be the center point for communication with the medical team, the family. If you've got maybe adult children that live out of state or out of town, knowing that care manager is going to be coming out and visiting about monthly, sometimes more, sometimes maybe a little bit less, and giving updates to everybody involved is a huge, huge benefit. They match those clients with their caregivers, and then they do all the supervision so you don't have to. In a facility, it's a controlled environment. There's supervisors usually in the building at all times. So if something happens, you can just kind of call somebody in and tell them that whatever you need to report on. Home care isn't always that way. You have people coming in. It might be a lot of different people. It might be a couple different people at the office that you can report to. And maybe it can be kind of hard to follow the pipeline of communication or who's in charge of it all. Whereas with us, the care manager that you are working with directly, they are in charge of all of that supervision. So if it's something as big as this caregiver's, doesn't know how to do my lift, or as small as, they just talk a little too much and I really like to rest after my shower, it really takes a lot out of me. That's what you can tell your care manager, so they do all of that coaching. We've got a chat. Okay, Carol asked, so your services are available where? Omaha and Lincoln? Yes, HCA Nebraska, we have offices in Omaha and Lincoln, so we service both areas, metro areas, and then anywhere in between. So I never like to give a black and white answer on where we can go, because we have served somebody in Norfolk. We have had clients in Nebraska City, Auburn, Plattsmouth. We go wherever we can. If we can find the caregiver there that can support you and we feel like it's going to be a safe and a good continuity situation, then we'll do it. Sometimes when you get further out of those areas, it does require us having maybe longer hours, because like a 2-hour shift in Norfolk, that might not be something that we can accommodate. But if it's somebody who needs 8 or 12 hours a day, then that's something that we could probably work out. Another question, how is the fee for various tasks established? So with us, we have an hourly rate, and I can send this out to all of you too. So we have 2 models of care that we offer. Because of our niche and what we do, we really open to be a long-term care provider. But with some partnerships that we've established over the years, we were able to open it up to a concierge model as well. So we've got concierge, which is shorter hours. So those are 2 or 3-hour shifts, and you can schedule those however you want to. You can do 2 hours once a month or 2 hours 3 times a day. Those shifts are really for people who are okay doing their own training, don't have wounds, don't have lifts, lower level. It's kind of like an introductory period to home care. You don't need a whole lot yet. You just want to get comfortable with it and have a little bit of help to make sure that you can get a shower done safely. So 2 or 3 hour shifts, they cost a little bit more because again, that continuity and that stability is so important to us that we pay those caregivers more, as well as their drive time so that they can make it to those shifts and stay committed. So on a weekday, a 2 or 3 hour shift is $37 an hour. And on a weekend, it's $45 an hour. But if you can commit to more hours and get onto our care management model, then the price goes down because we don't have to incentivize for those shorter shifts. So to get on that model of care, we require 4 hours at a time for a shift and at least 16 total for the week. So that's either 4 visits or 2 8-hour visits. And the range for that is anywhere between $29 and $32 an hour. We also, when we're looking at paying for 2 people, we almost are always cheaper than moving to a facility because we only charge an extra $3 an hour for a couple's care. So if we're providing hands-on care for 2 people, then it's just an extra $3 an hour. And then we have an option, and this is actually how I started as a caregiver, that's called Livid. And so this is really nursing home care at home. This is where you need somebody around the clock, but you might not need them to be hovering over you all night. So it's a reduced rate to be able to have 24-hour care in the home. And that is at $550 a day with another $50 added if it's couples care. So I did it for a couple. I would stay anywhere from 3 to 4 days at a time with them. And I slept with a baby monitor, so I could hear if they needed me. He had dementia. We got her diagnosed with Parkinson's, and they were both able to stay home until they passed away a few years ago. So when you're looking at paying for 24-hour care hourly, as opposed to with the live-in rate, it's a reduction of $200 a day to do live-in if you do need around-the-clock support. So that adds up over a month. And then also when you compare this, to if you need assisted living, that's not 24 hours care. That might be a 4-hour shift in the middle of the day or in the morning to get you started. A lot of times we recommend doing maybe 8 to noon so that you get up, get a shower, do meds, get breakfast and lunch done, and maybe some exercise in there. And then in the evening, if you do another 4-hour shift, then you can do like 6 to 10, and you can get dinner, meds, cleanup, and bedtime routine done. So that's a nice assisted living model that we offer. We have a holistic approach to care with our balanced care method. That's when we look at physical activity, social connectedness, spirituality, mental health, and nutrition. And that's built into every single one of our care plans. So when we're getting to know our clients, we're asking a lot of questions about how can we meet their basic needs with those ADLs and IADLs. But beyond that, we want to bring as much value as we can. And so we're asking, do you have a friend group that you used to meet with regularly, or that you would like to? What do you like to do to keep yourself mentally engaged? Or do you like to pray? Do you want to read the newspaper? Anything like that, we want to make sure that we're asking. And then provide assisted living to skilled care in the home by partnering with home health and hospice. So, we do have several of us here in the office that are medical, but we need those partnerships with home health, hospice, and other teams like Sherry's to be able to elevate the level of care that we're able to provide at home, so that we can keep everybody aging in place as long as possible. Okay, so here is a slide. I don't know if you guys want time to write this down, or you can take a picture of it with your phone, and I can also email this out to you. I just wanted you guys to have my email, and then that is my personal cell phone. So you guys can call me. I'm very good at texting if you like that. If you want anything, that's how you can get access to me. So I'll leave that up there just for a little bit longer, and we have about 8 minutes if anyone has any questions. Share. You said good questions throughout it. Thank you for typing those in the chat box.
May I ask a question or make a
Yes.
statement? I'm not sure because it's not really a question, but
That's
it's
okay.
good having some of this information. I'm on a Facebook group with Parkinson partners, caregivers, which is mostly national health out of England, Canada, Australia.
Okay.
And that's the biggest problem is they cannot get health care like this. Somebody shows up one day, is there for an hour and quits and doesn't come back, and then they're left with nobody. So it's nice to start somewhere. Thank you so much.
Yes. I'm glad that you said that, Carol. I hear that even from people in our area that, people start showing up or they might not have anybody. And like we talked about, the staffing shortage among all industries. I think if we drive by any restaurant right now, help is wanted everywhere. And so it is our commitment to our clients that if we decide and we agree that we need to start care together, we have a commitment to you that we will always come out and not miss our shifts. When we decided to get into this and to embark on specific conditions such as Parkinson's, you can't make a promise and then not deliver on it. So we have our caregiver teams that we build at each home. We have paid on-call caregivers that are ready to go and ready to get called in whenever. But maybe on those days when there's like a snowstorm and everyone gets called in, then we start going. So we'll make sure that everything is covered. Anyone else?
Can I ask a question?
Yes.
Do you work with, if someone has private caregivers and maybe has a day that one's in a car accident, would you fill in?
So in a lot of situations, we will partner with those private teams because some people can find contacts to build a private team. But on an emergency basis, we can't guarantee that because we're guaranteeing coverage. We see close to 500 clients between Omaha and Lincoln and have about the same amount of caregivers. Suzanne, your reaction is funny. It's kind of my reaction lately too, seeing how much it's grown. I kind of like to be a silent, bigger entity out there. But we have to guarantee coverage for the people that we've already committed to. And so if Monty, for you, if you do have that situation and there's maybe somebody that's going to be going on vacation or needs to maybe leave and you're going to have a hole in your regular rotation, we're happy to fill that part in, and then we'll always guarantee coverage in situations like that, because we'll even partner with other companies. We've got great relationships with other home care companies out there, and it's not the same 100% guarantee, but if we can cover it, if there is a hole, we'll always try to.
Okay.
But just like if you called like tomorrow and said that your caregiver got into a car accident, that unfortunately we wouldn't be able to guarantee that. That's where the pros and cons of doing privately versus agency come into play. That's another good question, I think, to bring up when you guys are all weighing all of the options out there.
To initiate coverage.
What?
Initiate coverage. If someone is going to work with you full time, what would you need to initiate them?
So you guys just give us a call at the office, and they'll get you to either myself or Olivia. Erin is in Lincoln. And so we'll talk to you through your specific situation. And then based on what our conversation is like, we pick the care manager we think is going to work best with you and send them out to your house. Sometimes we'll come along if we can. That's my favorite part of my job. So I try to go whenever I can. they'll visit for that consultation. It takes about an hour. It doesn't cost anything. And you guys will work together to determine a schedule, a start date, your needs. They'll start building that care plan. And then you kind of have your steps for moving forward after that meeting.
Okay. Thank you.
You're welcome. Oh, we got some chat box questions. Oh, thank you, Carol. Yes, she said, what sounds different, special about your company is your willingness to build a team and work with the client. We are very, very client-centered. We're in your homes. We are providing very personal cares. And coming from someone who used to be the caregiver, I try to set it up with, both the family and the caregivers to make sure that everyone's going to be happy. So that's usually what creates the most success. Gerald, do millennials have tendencies to be part of home care, or are they too busy with their own careers? Are you, Gerald, is that a reference to maybe the children involved or grandchildren or family members? I'm just going to assume that it is. And if it's not, you can correct me. I don't think that that they're too busy with their own lives. I think that it is very hard on family members to change the relationship that they have. My own grandma is in the hospital right now, and we just had a tough diagnosis last night, and we're working on, our next steps. And while I'm a nurse and I'm a caregiver, and this is what I do for a living, and this is like my life's work, I don't want to be that person for her because I'm a family member and I am having my own experience with it. So one of the coolest gifts that we can give to families is their relationship back. So you can be the wife again, or you can be the daughter again, and you don't have to have that caregiving relationship. So I know millennials are definitely looked at as being selfish, but I would not say that's the reason that they're not involved. I think that they just want to protect that family relationship. I just love the Parkinson's community. You guys are always so engaged and asking such good questions. So grateful to be a part of this. And if there's anything that I talked about that you guys feel could be improved on, or something that I missed, or something you guys would like to see more incorporated into home care, I'm all ears. If you did get my email down, we're always wanting to improve and evolve.
Are there any more questions? If not, Whitney, thank you so much for talking. That was incredible.
Yes.
Great information.
Yes.
Thank you guys so much for having me.
Yes. Thank you everybody for joining us.
Thank you.
Have a great day, everyone.
Happy Wednesday. Bye.
Happy Wednesday. Bye-bye.